Hello, my name's Dr. Caroline Dimond and I'm the Director of Public Health for Torbay Council. From the 2nd of December, as I'm sure all of you know, Torbay will be in Tier 2 of the local alert levels. That means we're in the high alert tier. Most of the country is actually in this position. There are only 2 areas in Tier 1 and quite a lot of areas now also in Tier 3. Now, when the government decided about setting this level, they were thinking of several factors. There was the overall prevalence, the number of cases per 100,000, the prevalence in the over 60s, the rate of change of that prevalence, how much the rates were going up or down, and the pressure on the NHS. Now, in Torbay, we've actually got quite a high percentage of older people than in lots of other areas, and a relatively small hospital that's often under pressure. So we have to be particularly careful. And also, as probably some of you know, just before lockdown in November, we had a significant rise in our prevalence, and we did actually at that time get lots of national attention. So actually Tier 2 feels appropriate from where I'm sitting. Now, putting us in Tier 2 rather than Tier 3 meant that the government and the scientists think we do have a chance of keeping the rates level and holding the virus in check. However, we won't do this if the rates rise again. And if they do rise again, that means that they might put us into Tier 3. Obviously, we don't want this because it would affect our economy and also our jobs. Now, for those of you who've been following these videos, you'll know that the rates went up in November, but also that we collectively took action. And together we brought those rates down quite significantly. Many of those of you were key to this, and many of you have been putting out my messages. So you've been part of that success, and I wanted to thank you for doing that. Now, there was also good news. Last week, the cases that we had were down to 125, and the rate was down to just under 92 per 100,000, which is very close to Devon's rate, which is just about 90, and less than Plymouth's rate of 116. So this demonstrates to me really clearly what's possible if we all work together. Now, as we come out of lockdown and into the Tier 2 alert, we have to do just that. We have to stay alert and we have to continue to think COVID. If we don't do this, the rates will inevitably rise again. Many of you, I'm sure, will be thinking about what to do at Christmas. As you do so, can I ask you to remember that we're also going into the coldest months of winter and the months that are usually the hardest for the NHS, when infections like flu and now also COVID tend to get a grip, and we need to stay more time indoors. It's at this time that messages about keeping your distance, wearing a mask and washing your hands become even more important. And the key message to keep away from people if you have COVID symptoms is absolutely critical. So as you plan for Christmas, even though you know the restrictions will be lifted for a few days, please don't forget this and try and keep your contacts with people as low as possible. The next few months, especially in December, January and February, we must still be alert. Maybe by March and April, with spring on our side and maybe with the vaccine in the pipeline, we can ease off a bit. But I hope 3 months isn't too long to keep alert. And that during these winter months, you can still continue to show that you can care for each other, but at a distance. So please keep on staying alert and keep on thinking COVID. Thank you.